Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What genital warts look like and where they appear. Genital warts are caused by the human papillomavirus, HPV. This virus is the most common sexually transmitted infection, STI. Nearly everyone who is sexually active will exposed to HPV at some point, but most people will not develop genital warts. /r/n/r/n It is important for you to know the symptoms of genital warts. The pictures of genital warts in this article can help you recognize them. Knowing how they spread and what prevention strategies exist is important for reducing your risk and the risk of spreading them to others. /r/n/r/n This article discusses genital warts, what they look like, where they typically occur, diagnosis, and treatment. /r/n/r/n Around 150 types of HPV have been identified, and about 40 of them are known to infect the genital area. Most sexually active people will encounter some form of HPV in their lifetime, but not all types carry the same levels of risk. /r/n/r/n Genital warts can occur from HPV types often referred to as low risk, non-cancerous. More than 90% of cases of genital warts are caused by low-risk types, namely HPV types 6 and 11. /r/n/r/n This video has been medically reviewed by Anita Sadati, MD. /r/n/r/n The appearance of genital warts can vary dramatically. Warts can appear as single bumps or they can occur in groups. They can range in size from less than 1 mm to several centimeters in diameter if a cluster of warts merges. They can be smooth or rough and may have finger-like projections. /r/n/r/n The most common appearance of genital warts is as growths the color of your skin. They can be raised or flat and can appear on, in, and around the genitals. They can grow in clusters that resemble cauliflower or appear alone. Genital warts can also be white, gray, purple, or brown. /r/n/r/n The timing of genital warts can vary widely from person to person. HPV infection can occur with or without the appearance of genital warts. Warts can take up to 2 or 3 months to develop on the skin. /r/n/r/n Please note that the images below are graphic and show male and female genitalia in detail. Discretion is advised. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n dermnit/r/n/r/n The picture above displays genital warts on the shaft of the penis. However, genital warts can appear on other parts of the penis, like around the tip of the penis and under the foreskin of an uncircumcised penis. Warts can also appear on the scrotum, as seen below. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n dermnit/r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n dermnit/r/n/r/n Above is a photo of genital warts on the labia. However, genital warts can also appear on the vulva and cervix. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Mahoney C., Gamberg M., Skaleff M., et al. J. Dermatolvenereal /r/n/r/n The perineum is the area between the genitals and the anus. The picture above shows a case of genital warts around the vagina and the perineum. /r/n/r/n This photo contains content that some people may find graphic or disturbing. /r/n/r/n Cincinnati STD/HIV Prevention Training Center /r/n/r/n The picture above displays genital warts on the upper inner thigh, but warts may also develop further down the thigh. /r/n/r/n. This photo contains content that some people may find graphic or disturbing. /r/n/r/ndr. Pawan lal /r/n/r/n. Genital warts can appear around or inside the anus. Anal warts rarely block the anal opening. /r/n/r/n. The location of genital warts does not always match up with areas of sexual contact. Warts usually appear at the site of reported contact. However, they can also be found at sites where people report no history of sexual contact. /r/n/r/n. Genital warts may appear in any of the following places. /r/n/r/n. Genital warts can be spread even when no warts are visible. /r/n/r/n. In most cases, healthcare providers can diagnose genital warts just from visual inspection. However, some lesions can be hard to identify. In those cases, practitioners may do a biopsy, removing a sample of tissue for examination in a lab, to confirm the diagnosis. The biopsy can confirm the presence of HPV and identify the subtype of the virus. /r/n/r/n. In addition, a special test, called a colposcopy, using a magnified scope to look at the genitals can help healthcare providers to better see lesions inside the vagina and on the cervix. /r/n/r/n. Genital warts can be mistaken for other types of lesions that commonly appear on the genitals. Some of these include /r/n/r/n. The Centers for Disease Control and Prevention, CDC, in its 2021 Guidance for Screening and Prevention of STIs, states that vaccination is the primary strategy for preventing HPV. Vaccination with Gardasil 9 is recommended as part of routine care beginning at age 11 or 12. /r/n/r/n. The HPV vaccine is approved to be administered as early as 9 years old. It can also be given, in some cases, up to age 45. /r/n/r/n. Genital warts may go away on their own without treatment, often within 1 year. But it is also possible that they will grow and spread. They can also stay and remain the same size. /r/n/r/n. Treatments include prescription creams or gels you apply yourself, such as Aldara, Imiquimod, and Condylox, Podophylox. Your healthcare provider can also remove warts, uses cryotherapy or use a laser or electrosurgery, electric current, to burn them off. /r/n/r/n. With treatment, visible warts will usually go away. For some people, genital warts come back even if they follow all the steps for treatment. Even after treatment and without visible warts, you may still be able to pass HPV to sexual partners. /r/n/r/n. Over-the-counter, OTC, wart treatments that contain ingredients like salicylic acid and benzoyl peroxide should not be used for genital warts. These products are not designed for treating warts in the delicate genital areas. /r/n/r/n. Seeing a healthcare professional is the best way to ensure you receive the appropriate treatment for genital warts. Some home remedies claim to help get rid of warts, but many of these are not supported by evidence and may be unsafe to try on genital warts. /r/n/r/n. One folk remedy for treating warts is the duct tape method. Some research does show that it may be effective. But this method is more appropriate for common warts on areas like the hands, feet, and arms. It should not be used on genital warts. /r/n/r/n. Some people also suggest using apple cider vinegar and tea tree oil to treat warts. However, there is a lack of research about their effectiveness in general and specifically on genital warts. In addition, these remedies may cause burning and irritation. /r/n/r/n. The most natural and evidence-supported at-home remedy for genital warts is the application of a green tea extract known as cinacatechins. Experts believe this green tea extract may have antiviral and anti-inflammatory properties that help eliminate genital warts. /r/n/r/n. Topical cinacatechins 15% ointment, sold under the brand name Verigen, is the first botanical drug approved by the Food and Drug Administration, FDA, for treating genital warts. It is prescribed by a healthcare professional and typically self-applied. /r/n/r/n If you think you have genital warts, see a healthcare provider for diagnosis and treatment. Self-identification and home-based remedies may be unsafe and are unproven. Medical professionals are trained to examine and treat private areas of the body. /r/n/r/n Genital warts are a symptom of infection from certain types of HPV. They typically appear on the genitals but can also be found on the anus and perineum. /r/n/r/n Any wart, bump, or growth should be evaluated by a healthcare professional. Typically, a visual examination is all that is required. Your provider can then prescribe treatment for your warts, if appropriate. At-home treatments are typically not effective or safe on the delicate skin of the genitals. /r/n/r/n When untreated, genital warts may disappear within a year, but the exact time it takes for them to clear can vary. With treatment, warts may go away faster. However, since HPV may reside in the body, warts may reappear over and over again. /r/n/r/n Genital warts may feel rough or smooth. They usually are not painful but may cause discomfort, itching, irritation, or a burning sensation. /r/n/r/n How long it takes for genital warts to show up can vary. Some people may develop genital warts within weeks after infection. But for others, it may take months or years after infection for warts to appear. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.